Welcome, new graduate physiotherapists, to this in-service about using cough assist machines in the ICU. Please refer to our case study of Anastasia, particularly for the next slide. So patients with Guillain-Barré syndrome often have weakness in the expiratory muscles, such as abdominals, and inspiratory muscles of respiration, such as the diaphragm. How strong these muscles are leads to how effective the patient's cough is, and therefore the patient's ability to clear secretions. A patient with Guillain-Barré syndrome could benefit from a cough assist machine, at least in the initial stages, to help them cough more efficiently in the ICU and clear their secretions. So a brief description. So the cough assist machine applies positive pressure to fill the lungs, which then switches to negative pressure to produce high expiratory flow rate, and this helps the patient cough. It can be applied in multiple ways. So you've got a mouthpiece, a mask, an endotracheal tube, and it's actually most useful in patients with an ineffective cough due to muscle weakness in neurological conditions such as Guillain-Barré syndrome. So some indications for the cough assist machine include if the patient's unable to clear secretions, as I mentioned, due to muscle weakness and reduced cough effectiveness. If they have a peak cough flow of less than 180 liters per minute, they're going to be unlikely to be effective at clearing secretions. And it's useful in preventing respiratory complications due to secretion retention and poor tidal volumes. So we've got some contraindications and precautions here more generally. So some precautions are if the patient's dependent on oxygen, if they have emphysema, it's patient compliance as a precaution. In particular, for our case of Anastasia, just need to make sure that she's definitely compliant since English is her second language and she's from the Ukraine. So just making sure that there's consent there. And also airway obstruction is a precaution as well. Some contraindications include vomiting, facial fractures, raised intracranial pressure, or if they've had a recent upper GI surgery. Thank you all for tuning in today and listening to this in-service. I look forward to seeing you all next week to delve deeper into another treatment consideration that we can make in the ICU.